Welcome to the latest edition of Exploring Health with Cleveland Clinic London. I'm your host, Kash Akhtar, a consultant orthopaedic knee surgeon. And today we're diving into a topic that affects us all: how to take control of your health, prevent problems before they arise, and get fit in a way that reliably works. If you want to understand how early health screening and structured training can prevent disease, optimize movement, and improve long-term health and performance, then this is the episode for you. We're bringing together two experts in this field to bridge the gap between early detection and proactive health management so that you can optimize your long-term health. Joining me today are Dr. Chris Roughley, General Practitioner here at Cleveland Clinic London. Chris is here to discuss the power of screening, not just for detecting disease, but for optimizing health and longevity. And Dr. Mark Gillett, Consultant in Sports and Exercise Medicine and Chief Medical Officer for the Premier League. Mark works with elite athletes and executives to tailor training, recovery, and movement strategies for success. So whether you're a professional balancing work and health with no time to train, but you know you should be doing something, or an athlete fine-tuning your recovery, or just someone looking to take control of their health and get started, we're going to give you the roadmap. So Chris, let's start with the basics. What is health screening? Why is it important? And who should be considering it?
Hi, thank you. So I think fundamentally we should ask the question, what is screening?
Yeah.
And that is looking for early signs, early risks, early detection of medical problems. Because the sooner we find things, the better the outcomes generally are going to be. So there are a number of ways that we can do this. And we are using different modalities, that's bloods, physical examinations, imaging techniques, all combined to look for these early risk factors and enable someone to, like you say, take control and improve outcomes. At Cleveland Clinic London, we offer a number of different screens. We offer an advanced health screen. This encompasses particularly a heart-focused assessment, but is looking at multiple factors of the organs, so kidneys, liver, lungs, heart, general physique examination from us. We're looking at nutrition, we're looking at mood, we're looking at your sleep, really trying to give a holistic approach to screening.
Okay.
We don't want it to be somewhere where you just pop in for a couple of tests. It is more in depth than that.
It's not just MRI head to toe and off you go.
No, and that's not the way I think screening should be.
Yeah.
You want to discover a problem, target those risk factors, and have someone there to promote and support the change. Just popping in somewhere for a scan, it's not that helpful.
And invariably they'll pick up something.
A lot of the time.
Yeah.
And we should probably raise that as a point. There is a lot of talk out there of the negative impact of screening, and that it does cause downward stream additional testing that might not be relevant. However, my experience is quite the opposite. And when you have an expert looking at all those figures and you as a whole, we know what to do and what not to do. And I've only seen really successes in identifying serious problems early on, and then supporting that person through to make better choices.
So you mentioned the screening programs at Cleveland. You mentioned the advanced health.
So that's their first phase. Beyond that, we have the executive health screen and a women's health screen.
Okay.
The women's health screen is a relatively new package that we've offered, primarily targeting women over the age of 45 with mammogram and hormone testing, as that's a real hot topic at the time.
It's also going to be our next podcast, actually.
Yeah.
Wow. Yeah.
I can believe it. So that's an advanced health package with those additional factors. And then we have the executive health screen, and that is a much larger program of investigations. That is a real head-to-toe review of somebody, really trying to target as much as we can to get those individuals in absolute pristine condition. They're often very high-functioning individuals with very demanding jobs and little time. So we need to be in there, very clear on what we're doing, and targeting as much as we can to get them absolutely firing on all cylinders.
Right. Because we know that the early detection of heart disease and cancers and various things can improve outcomes.
Phenomenally so. Just this week, I've had someone that I, fingers crossed, have absolutely stopped him having a heart attack. He had a very vulnerable blockage in his heart that he was unaware of, had no symptoms of, but was a ticking time bomb. And through our executive health screen, we were able to very quickly identify that. And within 2 weeks, he's clear.
Which is a great example. The next question I had, which was that what do you say when someone says, I feel fine, I'm not worried about anything, why should I get screened?
So some individuals head towards screening services because they just would like to get to know their body and get a baseline for where they're at. You don't have to have a problem to come for screening. There's many different reasons why people come, but, I'd put it out there, would you like to know what's going on in your body? Do you want to know what's happening to your heart? I think if you asked everyone on the street, people would love screening. They'd love to understand themselves better. And we're here to just support that.
And I guess some of the challenges of screening on a national level are predominantly health economic arguments. But I guess we're quite privileged where we are that actually that's not so much a challenge and you can actually get the tests and do the things that you want to do.
I think we are still thoughtful and mindful of what we are investigating. We don't check for everything. We should do it in a considered approach. But yes, we have the most amazing facilities and resources and the teams. One of Cleveland's, I think, unique selling points is the fact that we are a team of teams. And I find it a real privilege working where I am able to just cross a corridor and speak to an orthopaedic surgeon, to cross the other corridor and have a chat with a cardiologist. And we discuss our patients and we share feedback in real time. That makes screening amazing for me because I pick something small up. I'm not quite sure what's going on. I'll find out in 15 minutes.
Yeah.
Because those resources are there. It's not somewhere you just rock up, have a few tests and go home and you might get a paper report. That's not really the Cleveland Clinic way.
I'm going to have to clip this bit where you said it's a real privilege to talk to an orthopaedic surgeon. Because Mark doesn't feel like that, do you?
No. I have to disagree with you there, Chris.
and it's interesting because now medicine historically has been reactive. And now we're moving towards this almost proactive approach. I was talking to Mark the other day. I was reading Peter Tier's new book, Outlive. He talks about medicine 3.0. Medicine 2.0 was kind of, you've got an infection, here's an antibiotic. You've got an issue with your knee, here's a knee replacement. But now we're moving very much towards preventative medicine. And so things are really beginning to change. So Mark, Chris has talked about identifying risks early, but once people have that information, what should they do with it?
I mean, I think there's two broad categories that you need to consider. One is identifying your risk factors for chronic disease, which clearly are a priority. And, we've spoken about screening. So for a man, that might be prostate. For a lady, it might be breast, all those typical things that we look for. And then I think my job and the way we move it on, we get it to take another dimension is, how do we get you to perform better? So, so my job as a sports and exercise medicine specialist, I think, we should replace the exercise bit with performance because, there's a lot of things in terms of the way people function, both, physically, psychologically, nutritionally, that we can optimize and make people feel better.
Now, if we look at how to kind of take the bridge from screening towards, your action, say you've got a 40-year-old executive who's found to be hypertensive.
Yeah.
What's your approach for that?
Well, I mean, I think medically, what's the immediate risk of the hypertension? So, is it immediate risk of a complication of hypertension, in which case he probably needs to see somebody who deals with that as part of their core medicine. And my job is then, so what's your lifestyle like? What do you want to do? Where do you want to go? So once the medication's been brought under control, all our things in terms of your lifestyle, all our things in terms of your exercise habits, all our things in terms of your nutrition, all our things in terms of your stress, all that we can factor into, really developing a performance solution for you.
One of the challenges is now we see so much conflicting fitness advice,
Yeah.
particularly on social media.
Yeah.
You go on Instagram, it's
Yeah.
mad. What are the biggest mistakes people make when they're trying to get fit?
I've had this conversation a few times today. So, I've been a doctor a while now. You and I both know how long that's been, and probably not going to broadcast that on the podcast. But when I started in sports medicine, I'd have people who were sedentary coming to say, I want to run a marathon. And now they come in and say, I want to do an Ironman. It's sort of, well, why? Why do you need to do that? So, why don't you give yourself some staged targets which you can maintain and you can progress over a period of time? So people give themselves a schedule which they can't possibly maintain, a lifestyle they can't possibly sustain, and they end up falling off a very steep cliff and going back to where they were.
And that's without overuse injuries, tendinopathy, stress fractures, the rest, muscle issues, the rest of it.
And I think you possibly, to a degree, but I think the major problem is you're writing a check which you can't continue to cash. So if you're going to the gym 2 hours a day, 5 days a week, you're not going to sustain that.
You can't, no. And do you have any examples of common fitness myths that actually cause harm?
Yes, I think so. Poor advice is very easy to find. I think the problem in medicine is up until now, the advice people get about exercise has been binary. So if you've got a bad knee, don't run.
Yeah.
If you've got a bad back, don't squat. Well, actually run in a way that doesn't upset your knees and squat in a range which your back can tolerate. So, I think there's always a way. I always like to think about, rather than most patients I see have been told what they can't do, my job is to tell them what they can do and then build from there.
I say it almost to every patient I have, is this word sustainable.
Yeah.
It has to be a sustainable change so that someone will engage with it forevermore.
Yeah.
That they will see continued improvement and gain from. If you do a fad, any fad, whether it's backed by science or not, if it's a trend thing, it's not going to last, I don't think. It's got to convert to that sustainability.
Yeah. And we see it every January 1st, don't we? The people hitting the gym with a new fitness regime that doesn't last beyond a couple of weeks. And it's interesting what you talk about, as a knee surgeon, the thing I hear other knee surgeons say is don't run, it's bad for your knees. And yet there's so much value physically, physiologically, mentally from running. And I always say to people, if you want to run, but let's find a way that you can do it. And it's about appropriate load management, isn't it? I say, like, your normal load management is here. You've got a cartilage issue. You've lost some meniscus. Your load is now down here. Yeah. So what's that envelope of function? Well, maybe you can run 5K once or twice a week, but going beyond that is a bit too much. Yeah. You get pain and swelling. Your body tells you it's too much. Just dial it down. Yeah. Work with that envelope. And with your strength advice, the conditioning, that can go up a little bit.
I think, so there's got to be some level of compromise and acceptance from those patients. A common sort of question I have, or common discussion I have with runners is don't run long and slow. So it's really easy if you're a runner, just get into a lazy training program where you come in from work, you do, run for 30 minutes. And the problem with that is that if you've got a lower limb injury, the slower you run, the longer your foot's in contact with the ground, the greater the contact force is, the greater the load on your body, the greater the toll, the greater the recovery time, all those things. So, if you want to run, initially run fast and run short and run those intervals and then build from there. So, and that's difficult for a runner. So somebody, a marathon runner, who's used to a high volume program, but that's a compromise, and that's how you sort of build a training program that really works for them.
And I think one thing that I have noticed in kind of our collaborative working is that Mark is great at all sports. You are an all sports guy, and you are able to really ascertain that individual's needs and have the most amazing connections of supporting that person and finding the right trainers, etc., that really match them. And I can really see that, and then the benefit my side of a happy GP patient.
And as you say, Mark, it goes so much beyond that, isn't it? For runners, you want to make sure they've got appropriate footwear.
Yeah.
That they are the biggest failure I see, or the biggest challenge I see with the runners is that they don't do any strength and conditioning. They just run, and then they'll end up with gluteal weakness, resulting in ITB syndrome or something like that.
So 2 major problems generally with endurance athletes. One is, you're right, conditioning work is the first to go. Secondly, they have what we call a poorly periodized program, and there's not enough variety and there's not enough recovery time. So they tend to do the same thing time after time, and that's what leads to injury. So things like heart rate monitor, really, really useful. So you're working in a different training zones, you're stimulating the different parts of your cardiovascular system, and you're really developing your fitness. And I think it's very easy just, training program by definition must be progressive. So it's very easy to do the same thing, and all that will do is you won't get any fitter and you'll end up getting injured.
So if we talk about how to go from screening results to an effective training program, what should they prioritize?
So I think the biggest change in sports medicine, exercise medicine, in my time in being involved in it, has been the understanding now that maintaining muscle mass as you get older is really vital to aging well. So,
and the key to living longer.
Yeah, absolutely. And we all want to do that. So making sure that you have a strength stimulus in whatever you do is really, really important.
Okay. And you mentioned periodization.
Yeah.
Can you explain that for me? Because I don't quite understand it.
Right. So periodization means different zones of training. So there's obviously the lower zones, zone 1 and 2 work, where your heart isn't working particularly hard, and then 3 and 4, which is your sort of general zone where people all train a little bit harder, and that's probably what people would do when they're going for a comfortable jog. And then you go above that to zones 5 and 6, which are threshold and VO2 max, which are the higher end of your physiology. And really, you've got to stimulate all parts of that spectrum to get fitter.
And I guess there comes a point where form is key as well for a lot of things. Right movements.
Technique.
Yeah, technique.
So we know that. So the low compromise bit is the low compromise discussion is a really useful one, and a really sometimes quite difficult to get across to patients. So if you're a bad mover, you're mechanically inefficient, then it's going to take a lot less load to get you injured. So part of the buy-in in the rehab program is to make you more mechanically efficient, so you can absorb more load, you can train more and get fitter. So that's the investment you're asking patients for.
Right. And so say you've got someone who's now starting out. I think the reflex a lot of people is to just get a pair of trainers and start running, or join a gym and just go for it. So how would you advise someone to start training from scratch?
Well, there's nothing wrong with that. So I think you don't want to be a killjoy and dampen everybody's enthusiasm. So find something you love, find something that you enjoy. And so I always say to people, particularly when they're full of vigor and they really want to make the change, imagine the busiest week in your life. Imagine your busiest week at work, your busiest week at home, and what's the bottom line that you can't drop below? So what's your bottom line for either your rehab, for your strength stimulus, or for your fitness to get fitter? And probably it's about 15 minutes 3 times a week, about that type of time period. So if you can do that, and you can start with that, you can get fitter and you can get healthier.
And I think if you're starting from scratch, there's huge value in working with a strength and conditioning coach or a personal trainer to guide you, to show you the correct exercises, perhaps to create a program for you.
Yeah, there is. I use a strength coach once a week on a Friday, and it's great. I don't have to think. It tells me what to do. It's a very efficient way of using an hour. It's relatively expensive, but it's a very, very good tool if that's something that you can, your means will stretch to.
Yeah. And I would say there's lots more online apps and programs now that seem well structured.
Yeah.
It is interesting because having accountability is huge, isn't it, when it comes to sustainability? So having a training partner, I started working with an online strength and conditioning coach a few months ago. And honestly, he intimidates me slightly.
Right.
So it's kept me accountable, and it's meant that I kept doing it because I know someone's going to be asking me and checking in on me. It's only been a few months, but you don't get a body like this overnight. But there's huge value in that.
Yeah, but I actually think even taking a step before then, that actually on the exec health screening program that we offer, we're doing that. We're your initial performance coach. And I am holding patients accountable. And I am saying to them, you've invested well in this screen. I am here for you. This can be an amazing partnership and I will help you get from A to B. But I need you to be committed. And, if you're interested, I will give you my time and I will find the best people for you, etc. We'll work out where to start. And I'm seeing the whole breadth of absolute peak fitness people already that really need athletic Olympic guidance. And I'm seeing people that are ready to start couch to 5K.
Yeah.
And you're trying to find the right fit for them, the right step for them, the sustainable step for them. But we'll start that partnership here.
Yeah. And get the ball rolling.
Yeah.
Can I ask about, for both of you, diet and nutrition? Because that's a thing that it's not really taught in medical school.
No.
And yet it's vital, isn't it? You can't out-train a bad diet. So do you have any rules, any pointers, any kind of go-tos for when it comes to diet and nutrition?
So this is probably controversial, but one thing I find frustrating is the adage that people stick to meals. So I think I always explain to patients, I always say to them, look, learn to eat when you're hungry, not when society tells you should. And I think if you can learn that, and there are ways of learning it and there are ways of introducing it. Intermittent fasting is a great one. You can really inform people about how that really works. But I think, there's a lot of bad advice out there. You've got to have breakfast. Well, why?
Yeah.
It's much more helpful if you don't eat for 8 hours a day and, you're that insulin sensitivity and all that type of thing that we look at. I think there's a lot of ways where you can really, develop that sort of intuition.
Yeah, I think intermittent fasting is a thing that's really come to the fore. I mean, I've been doing it for the last kind of 8-9 months, and
hadn't noticed.
Yeah, I don't like to talk about it. But,
yeah, of course.
But it's been, and perhaps I've gone a bit further. But the challenge, I think, the thing that's interesting is that rather than eating because it's, as you say, because it's lunchtime, and eating something that you don't particularly, you're not hungry, or eating just because you think you should. Yeah. If you're not hungry, or you're not, or you're, and with our work schedules, there isn't time to perhaps have something healthy, and rather than just eat a sandwich and a packet of crisps and a Coke can and a Mars bar, it's almost better just to keep going, have a black coffee. And I'm not saying that works for everyone. This is not medical advice for everyone, but I'm saying for certain people and certain lifestyles and certain mindsets, I think it really works.
Yeah.
I think that's what's good in getting to know a patient. Number one is, what's their schedule? What will fit in with their scope? What can you adjust in an agreement together? The exec health program comes with a 30-minute nutritional appointment. So you're going to get dietitian support from us anyway, from the doctor as well, but there's additional support there available automatically, which is great. And I work quite closely with them, and because it's such a massive area and there's so much chat, and I can't help but scroll on Instagram sometimes, and it is, what do you trust?
Yeah.
I do, I intermittent fast as well, a little bit. Can't help it at weekends. I've got to break it sometimes. But I do think that's helpful. Little bits that I like about nutrition is, one, what you're breaking your fast with. I think it makes such a difference if you start healthy, if you get the right ingredients there. That definitely, for me, means that I make better selections throughout my day. I'm far less likely to snack on bad things if I've started right.
Yeah.
If you go,
and if you've planned meals, I guess, in advance as well.
Yeah, and there's a lot to be said for prepping to try and fit in those healthy bits in the day. And I do argue that healthy foods don't take ages to make. Yeah. That bowl of yogurt and seeds and fruit take me 90 seconds to make in the morning. It's not hard, I think, to start right. And even that can be step one with a patient. Yeah. That one.
Making decisions in advance rather than on the hoof means that you can really be well prepared.
But even if you start right, when you're then on a hoof later on, you're more likely to make the right choice then as well. So you've actually then one twice in your day, and you
Yeah.
can feel good about that. And the other thing that I like is when you go to eat, is that going to, one, really make you happy? Are you going to feel guilty after it? Are you going to feel bad for having it? Will that really help you? And if you can take that 10 seconds to think about it, you'll probably make smarter choices. And it's those little steps that get you into thinking in a healthier way.
And it could be that we're talking about intermittent fasting, but you don't have to skip breakfast. It might be that you have breakfast and lunch and you skip dinner.
Completely.
There's different ways to make
Whatever
it work.
works for you.
Yeah. So we talked, weight management. I think one of the challenges is managing weight. It's a problem worldwide, community-wide. And so we touched on intermittent fasting. Other things that have been quite prominent have been things like the 5-2 diet. Do you ever discuss that with patients? Is that a thing that comes up with you?
I don't. I think that one's kind of died down a little bit in terms of trends. I think it's more intermittent fasting that's popular. I think the thing is to get the patient on board with their weight. What would they like to do, first of all, because they might be happy with their weight.
Yeah.
But I think when we've done all the screening and you can put together the body composition testing.
Yeah, tell me about the body composition testing, sorry.
So we have a machine called Seeker. It's a very simple thing. You stand on it, you put your hands on the side of a rail.
Right.
And it gives you a load of data. We're looking at BMI, fat mass percentage, skeletal muscle mass, amongst many other factors.
Visceral fat, body fat. Yeah.
Visceral adipose tissue. It gives you something called a true score at the end, which can be a helpful marker. A true score is looking at same age, sex and height of an individual. And 100's kind of your go-to average figure that you want to reach to be healthy.
Right.
So you've got a marker there of, am I under average? Am I above average? And, if people come back for regular screens, that's quite a nice marker for them to see where they're improving.
Yeah.
I'm really interested in the fat mass percentage and the skeletal muscle mass. And really the skeletal muscle mass, probably because, like Mark has said, and you have said, muscle strength, longevity, it's there. If you've got good thighs, you're living well.
Yeah, it's thigh muscle mass is the
it's really there's good data for it. Yes, so I find that really interesting, and I think when the patient can sit down and go, okay, like I know I've been overweight for a little while, but now you've just presented to me that I'm 48% fat.
Yeah,
it's quite powerful.
Yeah,
and I think part of it is knowing what normal range is. So for some females, over 30% of fat mass is normal, and that's okay. And, they might be panicking that they're really overweight. And I'm like, no, you're actually healthy, but your skeletal muscle mass could do with some work. So, I find the Seeker body composition a really helpful tool in screening.
I want to have a go at that. Sounds really quite interesting. And you've got experience with these new GLP-1 agonists, the Ozempics, the Wegovy, the Mounjaro.
Yeah.
Tell me about those.
So these are medications that are making you feel fuller, so that you are less likely to eat. So it's helping you essentially with a degree of portion control. Now, I think they have a place. I'm not issuing a lot of it. I'm really trying to get people to have a real good grasp of their diet, of their exercise, and work on some good plans to make positive body changes.
Sustainable ones.
And the data's out there at the moment that when you are on things like Ozempic, when you stop, that weight's going back on. Unless you've really made those sustainable life choices. And you're less likely to engage with those life choices if you've seen me and got a script rather than worked with me in partnership.
Yeah.
So I'm looking for the partnerships.
So you see it slightly differently, because a lot of people think that these new drugs are going to be revolutionary and will, beat the obesity crisis.
Like I say, they have a role. I think they will be really important for some demographics of people. What we don't know fully is long-term use. Is it okay to use them for a decade? Is it safe just for 2 years? That's the kind of stuff that we're not there yet, but it's become very popular very fast. So we need to be mindful. I'm not saying that we should not be using these at all. We just need to be mindful. And it's about getting the right expert to help you with that.
Yeah.
I think, so I see certain patients whereby back pain is a great example, whereby, what's like, you're putting through an MRI scanner, no sciatica. So we know then injections don't work so well, not specific disc changes, and they're, 140 kilos. And that's always difficult because there's no medical intervention really that will affect their further outcome more than weight loss. So I think, it's very definitely a time and a place where a patient's body mass is almost such an overwhelming risk factor that the Mounjaro, Wegovy, all those drugs, that's where I see their real value.
And they can really start someone off on a great path.
Yeah.
I just think they need that additional support alongside to sustain the change.
Yeah, no, we recorded a podcast in here on exactly that. And as you say, you need that wraparound care as well, because you need the psychological, the dietitian support, some physical support, for exercise. And if it's just have these injections and then wean off once you get to goal, that's never going to last.
No, absolutely.
Mark mentioned strength training as a key pillar of health. Do you see that reflected in screening outcomes?
Yes, is probably the simple answer. Definitely the people on the body compositions that are hitting the good goals in skeletal muscle mass, that's achieved through weightlifting, I think, and some really good exercise. And you are seeing those people have strong true scores. I think that's a bigger positive indicator for it in being a strong level. And you can see it where someone is weak, you are more vulnerable to not getting over illnesses as quickly, to being more likely to fall and cause a bigger injury. You see it as people get older, they get increasingly less active, and it's a bad vicious cycle. There should be some program out there just making everyone do squats. Really.
I haven't told him to say that. I'm slightly obsessed with squats, which we'll come on to in a minute.
But he can't reach you under the table to kick you, can he?
Well done.
And Chris, not everyone may be familiar with the term metabolic health. And yet that is a thing. You would think that people who are fitter, stronger, more active would, as a result, have better dietary choices, better health, and better metabolic health. What is metabolic health?
It's a kind of all-encompassing term for cardiovascular and hormonal kind of health. So we frequently see this, what we call a metabolic syndrome, and it's a person with high fats in their blood, extra fat around their tummy, a high blood pressure. It all starts kind of, again, a bit of a vicious cycle of multiple comorbidities, multiple illnesses that will steadily cause harm to the body. And if you can really tackle that weight, ideally, you start to see all those things improve. And with tackling weight, you're improving diet, exercise, all those things that will help it improve.
Because you hear people talk about the inflammatory syndrome and people being, it being metabolic syndrome being inflammatory. And so is it fair to assume that the people who have that are more risk of getting heart disease, diabetes, cancers?
That will all interlink for sure. We know that if you've got extra fat around your tummy, it's increasing your diabetes risk. It's increasing your cancer risk. It's going to increase your musculoskeletal problems. There's more strain on your heart. It does all interlink. And I think it's more than inflammatory. There's so many aspects to it, even touching in with hormones being affected. This is why the screening, I think, is so good, because it doesn't just focus on one little bit. It's got all of it. And I think there's even more that we can do. Even I'm starting to really think about testosterone in men, because that feeds into that metabolic syndrome to a degree. There's lots of interlinking cogs into what's happening as we age. And I think if we don't take stock, take a baseline, make a plan holistically moving forward, you're going to end up with some health problems.
I mean, there's so many factors at play that go far beyond just, you've got diabetes, here, have some metformin. As you say, there's, and now diabetes, certain types of diabetes can be treated, reversed with weight management, can't they?
Yeah.
I mean, it's where a lot of the GLP-1 agonists came in the first place.
There's some very interesting, very simple programs out there that people can follow. I can recommend books and things.
Tell us.
So there's a book called Post Diabetes, and the gentleman that wrote that, Eric Emides,
Okay.
I might have pronounced that incorrectly. He's got a very clear program to get you into normal blood sugars.
Yeah.
It has just not been
Yeah.
endorsed by the right people.
It just amazes me that that hasn't come into common parlance there. And I do find that frustrating in that, so when you and I were house officers, sometimes you'd clerk a patient with who'd be on 15 medications. You go and see somebody, and every problem led to another prescription. Now, with diabetes, if you've got type 2 diabetes and you're obese or you've got a high BMI and you reduce that BMI, surely you've got to reevaluate the medications you're on. I mean, that's common sense. I just don't think that we're progressive enough in the way that we do that.
Mark, I want to talk about how to create long-term sustainable change. I think most people know what they should do, but struggle to follow through. So what's the key to making lasting changes?
Well, we've touched on it already. So small, impactful changes and building from there. So, start small, start with something that's achievable. Don't set yourself up to fail, set yourself up to succeed. So, so if you're somebody who's entirely sedentary, and you want to think about, how you begin to exercise 15 minutes, a couple of times a week, just walking, getting into that habit, making sure that you do it every day regardless, or, every time you've scheduled to do it, rather than finding something else to do and starting that meaningful habit change. I think that's really, really important. So that you're almost making a contract with yourself whereby you've agreed to do that and you build from there. I had intuitively, a football doctor, sports and exercise medicine doctor, somebody who wants to lose weight, sometimes intuitively they think, you're the last person I want to speak to. Well, actually, if you want to make that commitment and you want to change, I'm exactly the type of doctor you want to speak to because, I think we're very respectful of people who make that commitment to themselves and we've got the expertise to really support them into doing it. And I had one who came to see me about back pain and it's all, I do appreciate the honesty and the candor that a patient has to submit to you when they say, look, I know I'm overweight. That's a really big admission.
It's a difficult conversation, yeah.
Yeah, it is. Again, just, supporting them to, this guy was a chef, lost a lot of, gained a lot of weight, had an injury. And we're just able to give him some simple stepwise progressions where he can be healthier and happier. And I think that's really important.
Yeah, I think from liaising with the dietitians, I really like their small step of saying, every time you go to the supermarket, buy one thing you didn't have last week.
Yeah.
Just pick one different veg, one different fruit. And that will just automatically make your gut happier, give that variety coming in. And I'm like, that is such a simple thing to do.
Yeah.
I think even in my own life, I've tried to do that simple, small step. I now add seeds to, something, it's a small step.
Chia
but
seeds.
Psychologically, I'm feeling happier with myself because I've made a step and I'm feeling better for it. I think I'm doing something with my health. I'm now more likely to make the next step. And I think that you just need someone alongside you to support that.
Yeah. So small changes that are realistic. I've just bought a treadmill.
Yeah.
So
sounds like a pretty big change.
I've never run. Really. I run
so
after
you're the bad
balls.
patient.
Yeah. So my goal.
In.
Yeah. So my goal. So I shouldn't aim to run 5 marathons in 5 continents this year. No. Fall apart.
But if you do, go and see Mark.
Yeah.
People getting to see himself.
And I think one of the challenges is that many issues. So we talked about screening, but a lot of issues aren't visible on scans.
No. You'll know this, in that people put a lot of emphasis on scans. So if you have a normal scan and you've got pain, it doesn't mean you don't have pain. It just means it's not for a structural reason you can't see on the scan. So you've got to explain that to the patient and you've got to have a strategy whereby that scan positive, scan negative, and you can solve either way. But they're not the be-all and end-all of things. And I think good doctors know that. And we have good doctors in Cleveland. So I think, there's very, very few cases where scans are treated rather than patients.
And I must say, I've had a couple of consultations today like that. One of them is a colleague of ours, where there's pain and the scans are essentially normal or unremarkable. The challenge is that the quality of the scans is so high and the radiology is so good that we pick up things. And our job is to go, well, don't worry about it. That is in the different place. You don't you're not symptomatic of a meniscus. You've got a meniscus tear, but you're not here because of your meniscus tear. Don't worry about it. And I think that's a skill and a challenge to try and do that. And at least once or twice every clinic, I will say, whatever pain you've had, you've caused no lasting damage on your MRI. There's no lasting damage in your knee. Your knee's not fragile. Your knee is robust. Your knee is strong. But we need to put in things into place to help manage your symptoms so you don't get this discomfort, this pain at a certain time of your run. And that's where then I need help from people like you, from physiotherapists, from other people who are better placed in doing that than me.
I think the best example of that is probably a labral tear of the hip. Now, in some people, the labrum is a part of the hip which gives it more structural integrity. So
almost like a meniscus of the hip.
Exactly that. So I use that analogy all the time. Now, a labral tear can be an observation, and it usually is. So it's a mechanical observation that you've got this on your scan, and that probably explains why your hip's a little stiff. Sometimes it can be a diagnosis. Now, probably in my practice, 19 to 95% of the time it's observation, 10% of the time it's a diagnosis. So, you've got to inform. I'm one of those people, you probably remember years ago, where doctors were judged on how few MRI scans you did. Now, I don't subscribe to that. I think the MRI provides useful information mostly, but you've got to be able to describe it accurately, and you've got to be able to explain its place and its relevance to the patient, so that they're left in no doubt, what that means.
Yeah, because virtually every MRI scan anyone does sport shows a bit of inflammation deep to the IT band, a bit of edema within Hoffer's fat pad, and it's very much, interpreting it as you say.
Well, so the best example, I probably told you this before, if you do a football medical on a Premier League player, if you've got a normal lateral ligament of your ankle, and sometimes you used to wonder what you've been doing in your football career, because I think I've only seen that once out of, 100 times.
Yeah. Chris, when you give patients some health advice, what do you think separates those who go on and benefit from it and succeed and those who don't?
I think where they're at mentally, are they in a place for change? And I think part of my role is working that out and not always forcing them into that, preparing them, but facilitating them to be in a place where they're willing to make a change. I think there will be people that come and see us that just want the scans, because those people exist in the world. But I think when you have an experience at Cleveland Clinic, it's a good one, and you see the benefit, and then you can show how bringing on another expert, or making a change will positively impact you. I think part of the skill is getting on the right level of that patient, and every patient's different, but that's kind of a GP's skill is, we see so many different varieties of people with so many different problems. Getting on their level and making them see, helping them see the best way forward, that's what I'm here for.
Great. Mark, there's now a wealth of data information available. Can we just talk about trackers?
Yeah.
Because you see people with Garmin's, with Whoops. I see people with continuous blood glucose monitoring who are not diabetic.
Yeah.
Tell me about
we're talking
these.
about that all day today. So, look, I think the way that I look at it now is that, I'm bearing in mind, so, I was privileged enough to work full-time in Premier League football for a decade. So pretty much every metric going is monitored. So there's
in those bra tops.
Yeah. In those GPS tops, other ways and trackers or whatever. So it's every bit of data that you can imagine. And now we're coming into an age where we're talking about data burden. So the sheer volume of data that you're giving these young people is overloading them, and every week is another metric. If you wind that forward to the type of patients that we enjoy seeing at Cleveland, it's not dissimilar in that you've got to pick the metrics which are relevant to them, agree how you want to manage them, how you want to improve them, and not overload them. And the example I always use is, so I like to get on a bike, and the number of times you meet people for your sort of coffee before a ride. How are you this morning? I'm not too good. I'm not good at all. Why is that? Well, I've just looked at my Whoop, and my Whoop has said I've slept really badly. And I felt all right when I got up, but I've looked at the Whoop and it says that, my REM sleep is down, and now I've started feeling really tired.
Yeah.
So I do think, again, it's really choosing what's important to you and not overloading yourself with data and using data to inform your life rather than lead it.
So it's funny, I've got a tan line here where I used to have a Whoop.
Oh,
and I've just returned it.
Have you?
And it's slightly controversial because it is kind of the thing to have.
Yeah.
And yet, I've got 4 degrees. I'm not stupid, but I struggle to interpret the data.
Yeah.
And there's a wealth of data. And, some of it is so fine that it's really hard to understand, even as a doctor. And as you say, if it tells me I slept badly, I know I slept badly.
Yeah.
So that data is, I think there's value in it for some people, but I think it's really quite overwhelming. Yeah. Are there any trackers that you recommend? I mean, are you against them?
No, not at all. I'd say so. Data quality is really important. So one thing that I do think is really important. So a resting heart rate is really, really important. Now, personally, I think it's very difficult to get an accurate resting heart rate from a watch. You get a much better quality from a chest strap. And I think that's one thing I'd say, because knowing what your resting heart rate is really, really important. So it's important for 2 major reasons. One is going back to those training zones. So you'll probably calculate your training zones from your resting heart rate and your heart rate maximum. So knowing both of those accurately is important. Secondly, again, going back to all those years where I was looking after, athletes, there's no doubt that the most sensitive way of detecting whether somebody, either an athlete or anybody, is feeling over fatigued or not recovering or moving towards an infective illness is when you have an increase in resting heart rate. So even 2 or 3 beats per minute can be really significant. So managing and measuring that really accurately, I think, is really key.
And it's interesting, a cardiologist once told me that across multiple species, a major predictor of how long you live is your resting heart rate, not just in humans.
Yeah.
I think my view on data and trackers and things is you should be thinking about what you'd like to know and then pick your item after that. You shouldn't just be picking a tracker and then you're left confused about what you've got. I think it should be the other way around a little bit.
So tell me about, you'll have experience with continuous glucose monitors, the Zoes and things like that. You must see patients who have them?
Yes, but not that many.
Okay.
And you only use the monitoring for a little while, I think, if you do so. So I have definitely had patients that have done the program. I think it is interesting.
Yeah.
They are trying to get some data. So I think we should wait and listen and learn. I don't know that we all need to be jumping in there at all. We know that if you're going to eat some food, your sugar's going to go up and then it's going to go down. I think you can listen to your body and know that bread makes you feel sleepy. Do you need a glucose monitor to tell you that? There might be some nuances to your learning and things, but you might be able to do that from a food diary.
Yeah.
And just how you feel. And I think it's like you were saying about the tracker and your sleep. Listen to your body, and be guided by that. There's a lot to be said for it. The body's not stupid a lot of the time.
I'm not saying that trackers or data is, definitely useful. Just be choosy about what you want to measure.
Yeah, I think the challenge is that there's so many options now that there's an avalanche of data. And there are so many trackers, there's so many different types out there now that I think a lot of people can easily lose sight of it. And in this day and age, I think we're looking more and more for quantification for things.
Yeah.
That's certainly mine. Mark, let's talk about in sports medicine, recovery is huge.
Yeah.
But in general health, we don't really, it's often ignored.
Yeah.
Tell me, let's talk
That's
about
probably so. The two biggest reasons why I see athletes with injuries in clinic. So we're talking about people who come to see me because they've got exercise-induced injury. Generally, poor periodization, which we touched on, or inadequate recovery. And again, basic principles of getting fitter: stimulate the body. You have a super compensation, a super response. And then you've got to allow your body to recover so that you can go again. Now, if you keep training at the peak of that curve, then you're going to injure yourself. So active recovery is really, really important. So I have battled with players for many, many years. So it can be easy to recover if you're lying flat on your back and you've got a masseur hanging off each leg. Everybody wants to do that. But actually the value in recovery is very simple. So nutrition, sleep, hydration, and flexibility, and doing something active the following day. So active recovery, which means that you're taking responsibility for your recovery, is absolutely key.
And whenever you see players on TV and things now, you see them a lot in cold plunges.
Yeah.
Do you have any? What are your thoughts on cold plunges? It's not a thing. I hate the cold. So.
Well, there's definitely advantages to them. So cold water immersion, if you look at that, is any evidence base is probably not at a nice level. But there's no doubt there is some evidence and evidence in athletic individuals that cold water immersion can improve your recovery.
Because often you see in social media, so many people as part of their morning routine are doing like a 2-3 minute cold plunge in an ice bath.
I think there's, again, I'm not sure on the amazing scientific level of the evidence, but evidence of definite mental health benefits for cold plunging. I think my understanding was there's less for the musculoskeletal recovery aspect of it, and that actually almost warms potentially better.
And Peter Attia was talking about how, he's kind of one of the world experts, on health and wellness, was talking about how there's really strong evidence now for saunas. It's not a thing I do, but I think I should start. But there's real strong evidence that is very well linked to wellness. Yeah,
reduced dementia risk, things like that. Yeah. I think it's 3 times a week of 15 minutes.
Yeah.
I think is
Do you do that?
The program. I don't have my own sauna. I'm debating it. Yeah. But if I go to the gym and it's got a sauna, I will be in there.
You're in there.
Yeah, I am. But I like the warmth.
Yeah, me too.
But I will cold plunge too.
Yeah. Okay. So I stay clear of that. I come from a tropical climate.
I think the bit that I like about it and that I take from it is about mental clarity and coping with a stressful situation. So I know when I do it, I visualize.
Yeah.
So I'm practicing my visualization, kind of mindfulness. And then when you are in a stressful position elsewhere at work, etc., you should find it easier to be in control and manage that situation. And I do think that has a little element to it.
I might try that. So when I'm in cold water immersion, I'm normally swearing, which would then inform the way I respond at work. So maybe I need to change that.
Let's switch that up.
I think it's trying to find the right place. I think I was lucky enough that I did some dedicated cold plunging in Thailand, and I can take myself back to that image of being pretty much in the jungle. And it's a happy place. So I think, whereas I think if you're maybe in a football changing room, it might not be the most calming of environment.
Let's talk about supplements.
Yeah.
What's the role of supplements? Any supplements that I think absolutely necessary, some that you think are not?
I was helping Men's Health do an article the other day on supplements.
As part of your cover shoot.
I was trying to get on the front. Yeah. Again, heavily with the dietitian support from Cleveland Clinic London. And I was amazed I even got a mention, because my general view is stay away from supplements. I think if you are having a healthy, balanced diet, you're pretty much covered. I'm a bit more open to vitamin D because of this country and the lack of sunlight that we get, and people being indoors, etc.
And I'm seeing it even now more in Caucasian patients.
Yeah. I think we are getting better at sunscreen and staying out of the sun, and people are definitely trying to look after their skin, wrinkle less from sun exposure. So you are seeing a little bit more of vitamin D drops. We're testing it more, though, I think, as well. So we are probably picking it up more. But definitely open to that. Other than that, I would probably generally advise patients steer clear. However, there are definitely times and places, if you have an absorption issue, a gut problem, that you might be a high performing athlete, that it is a nuanced business and you will have a highly trained nutritional support guiding you. Yeah. But I don't think we all need 10 supplements in our cupboard that we're picking out now and then.
Okay.
So I'd say C, D, zinc and creatine would be the 4 things that I'd probably use regularly. This time of year, gram of vitamin C with some zinc in, I think, that can be really helpful at boosting your immunity. Generally, we like to keep athletic people, their vitamin D closer to 100, and it's pretty difficult to do that in a British winter. So most people can benefit from a high-quality vitamin D supplement. And then if you're an exercising athlete, creatine can be quite helpful.
So creatine is interesting. I've started taking it a few months ago at 5,000 milligrams a day.
Yeah. And you put on weight?
I haven't actually, no.
Yeah.
But interestingly, it's supposed to be good for training, for muscle building, for explosivity.
Absolutely.
That's the value for it, right?
Well, I mean, it has its use in endurance support as well, but most people would know it as improving your anaerobic burst. But it's certainly a reliable supplement that can, if it's part of a balanced training program, it can have additive value.
And I've been looking into it, and there's quite strong evidence that there's very little downside to taking it.
It's been around a long time now, and I think people, I'm certainly pretty happy it's safe.
Yeah. Great. What about glucosamine chondroitin? Because that's another one that comes up in knee circles.
I always say to people, look, I don't think that will do you any harm. It's unlikely to, make you any better.
Testosterone?
Interesting.
Yeah.
I think in the right people, with the right measurement, there is no doubt that testosterone can have a role. It's just, I think it needs to be bespoke and accurate rather than generic. I think if you're giving testosterone generically, there's going to be people who experience health side effects because of that. So we've got to be careful.
So I get that if someone has a deficiency, has a low score below the normal range, it makes sense to top them up. Are there ever a role to give it when someone's in the normal range?
Well, with their SHBG, it's high, so their testosterone SHBG ratio, their free testosterone is lowered, maybe, although I'm told that there's very little evidence for that. I think it's very new, and also, it's quite difficult to find that sort of information and clinical support on that at a really high level. And I think that will definitely improve over the next 5 years.
I think it's a real hot topic now, for sure. I feel like it's been neglected.
Yeah.
And I think we should be, I'm definitely screening testosterone way more than I have ever done before. And I kind of don't understand why we haven't been. I think even if you're down at that borderline range, why aren't we trying to optimize that? We're trying to do it with so many other different things.
Right, because we don't do that well enough opens the door to people who do it badly. You see what I mean? So if the ethical and the well-trained doctors aren't really, committing to do this well, then there could be a problem.
Yeah. And I realised I got very excited talking about supplements because the thing that interests me, and both of you said a healthy, balanced diet. But we haven't really quantified what a healthy, balanced diet is. Are we talking about, all the rage right now is about protein requirements, macronutrients. Yeah. So could you just explain what you consider that to be?
I think one thing is about protein. People struggle to get the recommended protein amounts into their diet with traditional eating habits. And so I think coming to us and getting some guidance on what your requirement is, your levels for your weight, etc., are, your training, etc. I think that is really important. I think I really like the 30 plants a week. I don't think Tim Spector's at all bad with that view of just trying variety and in trying to keep a rainbow coloured plate in front of you. that makes sense to me. It's getting the right nutrients, a range of nutrients
Yeah.
into your body. If you've got a healthy gut microbiome, then there's so many things going on, I think, that we don't understand yet fully. That food gut access, body access is really an interesting area. I find it interesting that still the dietitians are very much still held on the Mediterranean diet. So I think they're still using that as a basis, but they are really trying to encourage those whole grains, proteins, range of colour.
Yeah. No, we did I did a podcast elsewhere on microbiome, but I draw the line at sauerkraut and kimchi.
I'm surprised.
Can't do it. Mark, what's your take on protein intake?
I think one thing to recognise is it's expensive, so it's the most expensive part of your meal. So you have to be respectful about that with patients. But generally, I think it's important. So somewhere in the region of 1 gram per kilogram per day is about the right range. Probably varying a little bit depending on how much or how little exercise you're doing or how old you are. But definitely, I think I'd agree with Chris. People struggle to get enough protein on a daily basis and enough high-quality protein, and that's really important.
So protein supplements, protein shakes, protein bars, do they have a role?
Yeah, I think, so things like whey protein, which you can get relatively cost effectively and are relatively digestible. If you can take that immediately after you've exercised, it protects your lean body mass, your protein turnover, and it can be very effective.
And are you telling people to take pre-workout?
I mean, I'm a real caffeine enthusiast in all its different forms, in a drink, in a supplement, as performance enhancing supplement. But again, you've got to get the dose right. So somewhere, depending on what your tolerance is, somewhere between 100 and 200 milligrams, probably an hour before or half an hour before you exercise.
Okay. And time it such that it doesn't then interfere with your recovery and your sleep.
Yeah.
Okay, so we've covered screening, training, habits. If we wrap up now with some quick actionable takeaways, is there one change you wish more people would make for their health?
That's really hard to surmise in one point.
Yeah.
And I also think it depends on the individual, because we see so many different people that have probably got one comment for different people.
I'm going to come to you in a second. Have a think, Mark.
Yeah, I have been thinking about this all day, really, and what I could do. I think people should move more and eat a greater variety. That's probably the simple things.
Okay, that's two things, but I'll let it slide.
I know.
I'll let it slide.
Yeah, I think I would encourage probably for people to move.
I think that's the thing that's missing in the society at the moment is movement. Yeah, Mark, what's one wish you wish?
Well,
one thing
you've already touched on it. So I think everybody should learn how to squat properly. I think that is a great skill that underpins pretty much all of human movement. And if you can do that well, it's a building block to do anything else.
A bodyweight squat.
Yeah.
Great. Chris, where can people go to learn more about health screenings?
So you can have a look at the website, so clevelandcliniclondon.uk, and have a look at the GP Institute.
That's the URL, is it? I didn't know what the URL was. Okay.
I come prepared.
Yeah.
You can feel free to email us. So we've got health assessments at ccf.org. Or if you're interested in the exechealth.london@ccf.org.
Thank you.
I mean, I would also add to that, feel free to just come and have a conversation with one of the GPs.
Yeah, just book in and have a chat.
We'll because we have different things on offer, we can bespoke it, tailor it, etc. Sometimes it's good just to have that initial consultation just to find the right fit.
And where do you direct people who want to learn more about training effectively, smart training?
That's a good question. I mean, I think probably I'd direct them away from Instagram is what I'd say. So it's about moving them towards something more constructive. One thing I'd say is that probably to get stronger, you've got to work with something more than body weight. So have a think about, how that might work for you. How much easier if you go to a gym and you've got a range of weights. If you can't do that, there are other ways of doing it, but you've got to move with good technique. And you've got to load up to get the gains you need.
Perfect. So basically, takeaways are screening isn't just for the sick. It's, to help optimize health at every stage.
Absolutely.
And if you train, do it smart,
Yeah.
build strength,
Yeah.
resistance training
Yeah.
is where we're going,
Yeah.
recover well,
Yeah.
an appropriate diet, and focus on small, purposeful habit changes.
Brilliant.
Right. So you've been listening to Exploring Health with Cleveland Clinic London. I'm Kash Akhtar, and it's been a pleasure to have Chris and Mark on today's episode. Thank you for sharing your insights. If you've been listening or watching and you want to take charge of your health, please check out the links in the show notes. Book a screening at Cleveland Clinic London if you're interested, or go to the website if you want to learn more about optimizing your health. If you found this conversation valuable, please don't forget to subscribe, leave a review, or share it with someone who you think may benefit from this. Thank you. Until next time.